Time for the big number tonight here on Look Up TV and Look Up Weekend. I do welcome you to be part of the program by actually engaging us on our socials. At Amoy Brian on Twitter at Look Up TV. The hashtag we are using tonight is the big number. Let's get into the figures tonight. Now tonight on the big number, we dive deep into the 20 billion debts owed to hospitals by the insurer, that is the NHIF. Now it is time for this particular program where we dive deep into the most pressing issues affecting our nation. Tonight our focus is on the mounting debt that the National Hospital Insurance Fund owes hospitals across the country. Let's take a closer look at this alarming situation. Now the NHIF plays a crucial role in providing healthcare access to Kenyans. Nearly 80% of Kenyans have no private insurance and depend on the National Health Insurance Fund, which is also the backbone of President William Ruto's universal healthcare coverage plan. Now, in public hospitals that still accept NHIF cards as a mode of payment, services paid for by the insurer are either not available or require patients to visit private facilities for expensive tests. However, an alarming trend has emerged, a growing debt owed to hospitals. Let's take a closer look at these numbers. Now, the total money owed is 20 billion, which is from April to June 2023. This gets to affect a huge population, and hospitals and rural hospitals have about 350 rural hospitals which have also been affected. These figures are staggering and have far-reaching implications for both patients and the healthcare providers. But what does this mean for service delivery? Now, with hospitals burdened by the NHIF debt, the impact on service delivery is severe. Let's examine some key consequences with the stalemate, with this particular stalemate. Now, kidney failure patients are the ones to suffer the most, as on average a single dialysis session costs between 9,500 to about 16,000 Kenya shillings. Now, the repercussions of this debt crisis are widespread, affecting patients, healthcare workers, and the overall healthcare system. But what steps has the government taken to tackle this particular issue? I want us to listen to Health CS Susan Nahumicha.
On disbursement of funds to the National Health Insurance NHIF Fund. However, I am happy to report PCS as at this morning I received a call from Treasury that funds have now been disbursed to NHIF. And now the facilities, which I'm sure this is one of them, once your claims are verified, you are going to receive your payment. I want to call upon all other healthcare providers that they resume services, those that had stopped, as we process claims and ensure that we make payment. But again, I want to assure you that I am not going to oversee graft. I am going to ensure that we optimally use the scarce resources that are allocated to us.
All right, now recognizing the urgency of the situation, the government has implemented several interventions to address the NHIF debt crisis. Let's explore their efforts. Now, National Treasury Principal Chris Kipto announced the release of 33.3 billion to counties on Saturday. This is yesterday, to settle pending bills, with an additional 11.1 billion paid to NHIF. Now, the 11.1 billion Kenya shillings disbursement by the government now means that NHIF still owes hospitals across the country about 8.9 billion. President William Ruto, while campaigning, said that his government would prioritize NHIF to make healthcare affordable for all. Now, during Labor Day celebrations, President Ruto announced that the government had changed the contribution formula and that those paying 500 Kenya shillings, will part with 300 every month. Now, NHIF came up with two contract suggestions for the health providers, that is comprehensive and non-comprehensive. Now, all public and some mission and faith-based hospitals are under the comprehensive contract, while high-end private hospitals are under the non-comprehensive contract. High-end hospitals fall under non-comprehensive, which is Group C. Now, in this category, NHIF pays a daily fixed rate of 4,000 Kenya shillings. Now, the patient then bears the difference between this rebate and the hospital bill, either individually or through another insurance provider. Now, for example, at a high-end private hospital that charges 11,500 per night for a standard room, NHIF will cover only 4,000 and the patient will have to pay the rest. Now, in contract B, that is mostly for mission and faith-based hospitals, some fall under comprehensive and others under non-comprehensive. Now, besides paying for a bed and all other services, NHIF under this particular contract normally co-pays for certain major surgical cases. This means a patient pays for some surgical operations. Now, hospitals under contract A, which includes all government and public hospitals, this is where NHIF covers the full bill. That means a patient walks in with the card and walks out without paying anything. Now, that concludes today's Big Number segment. The NHIF debt crisis continues to impact healthcare in the country. All right. Up next is sports.